my EPQ is on medical informed consent in paediatric patients. So my final project title, is it ethical to allow those with parental control to make decisions regarding a child or young person's care? So my main aims and objectives of my project were to firstly gain sufficient knowledge and understanding, and then hopefully then be able to evaluate any possible ethical issues, and then hopefully reach conclusion at the end. So one of the hardest parts I actually found of my project was deciding on what to do it on. I didn't really have a definite idea when I first started. All I knew is that I wanted to do something kind of to do within the field of medicine, but I guess this didn't really narrow down my options very much. So I then began to kind of I made a rough list of areas I'm interested in. So the anatomy of the heart, its clinical applications, surgical advances, paediatric medicine, and then medical ethics also. And then from this, I then kind of brainstormed a few possible topic titles. So a few include, is the future of cardiac surgery minimally invasive? Can coronary artery bypass surgery be done by keyhole? What is sudden infant death syndrome? Is cryopreservation ethical? And then can the lack of medical informed consent ever be justified? So I very quickly realised that I was a bit out of my depth when it came to the topics regarding the more clinical aspects of medicine, kind of, I guess, the medical terminology and just scientific knowledge you had to know meant that it'd be very hard to do my EPQ on it. So this narrowed down my options to more medical ethics side. I guess I'm intrigued in medical ethics just because of the lack of a definitive answer and being able to kind of weigh up an argument, the pros and cons, and I guess how unique every situation is. Okay, so out of all the, I guess, ethics topics, why did I choose this one? So I will admit I was inspired actually after watching a TV show. In this episode, a young boy was diagnosed with a life. I'm not sure I understand. Oh, sorry. In this episode, a young boy was diagnosed with a life-threatening tumour. This would kill him if he didn't undergo surgical treatment. However, his parents' beliefs were against surgery. In this instance, the physicians can't disregard the parents' religious liberty. This meant that the patient was discharged. So I guess the biggest concern I had was that the child did not share the same beliefs as the parents. He was fully aware of the consequences of not having the surgery. So this then made me further kind of, I guess, think into whether children should be able to make their own medical decisions. I then chose to kind of research more generally into informed consent, although I found that this was too broad of a topic. So I then chose to focus specifically on informed consent in paediatric patients. And I guess this topic enabled me to cover not only the medical ethics side, but also investigate paediatric medicine, which is another interest of mine. So moving on to my subtopics, I began with just an introduction outlining my structure. Then I explained what informed consent is. So informed consent is the process by which a patient is given information regarding the purpose, benefits and potential risks of a medical procedure. So for example, a blood test or a surgery, to then decide whether to undergo a treatment or test. It's both a legal and ethical requirement to obtain informed consent before treating a patient, and it derives from the principle of autonomy. And so from the previous slide, if you saw the picture, it was of the four pillars of medical ethics, and so autonomy is one of them. So I then discussed the components which make up informed consent. These are that a person must have capacity, they must have been fully informed, and that the consent must also be voluntary, so they can't kind of be forced or coerced into making a particular decision. I also kind of touched on a few instances when informed consent isn't necessary, for example in an emergency or the patient is incapacitated. So, and then as I kind of went along and did my research, I refined my subtopics. I didn't have set subtopics when I first started. It was kind of quite flexible, and they just continuously changed as I did more research. So the Mental Capacity Act is what I touch on next. This kind of is the essential framework for making decisions about the care and treatment of people aged 16 and over who might then lack capacity. This is kind of, I guess, protecting those who then may not have capacity. However, it's only for people aged 16 and over. So this kind of made me then question, what is the protocol for those under 16? This is how I discovered Gillick competency. I'll touch on this later on. Next, so how informed consent is obtained. I began to compare the difference between adults and children. This then led me on to how informed consent changes as children grow and mature. Yeah, because obviously there's kind of, you develop at such a fast rate that there should be different kind of levels within childhood. So they actually kind of distinguish into 3 main levels. The first one is a child of tender years who kind of relies fully on a person with parental responsibility. The next is a Gillick competent child under 16. And then finally, a young person of 16 and 17 who actually can consent to treatment as if they were an adult. This actually surprised me. I didn't know that 16 was kind of such a crucial age, I guess, at that point. So I then touch on some of the legal aspects, and then also the idea of parental responsibility and kind of what decisions parents are able to make and what decisions they aren't. And then finally, I also talk about assent. I describe this as the kind of the gap that bridges between a kind of a very young child of tender years and a Gillick competent child. So I guess I'll quickly explain what a Gillick competency is. So Gillick competency is a child who is under 16, yet a physician makes the decision to say, actually, you have capacity to make your own medical decisions. So they can essentially choose to accept treatment without parental consent. So yeah, as I was saying, assent kind of bridges this gap between a child who has absolutely no say to a Gillick competent child who can actually almost make their own decisions. So assent, an example of perhaps a child giving assent is if I don't know, a young child was having a blood test, the physician would ask them which arm they'd want to have the blood test in. It kind of gives them some sense of control, and supposedly actually improves the child's cooperation in the treatment, and yeah, just reduces anxiety as well. I then finally go on to the history. I actually go back to kind of almost medieval times, where actually it was kind of seen that physicians were meant to kind of keep patients in the dark, in terms to keep kind of patients hopeful, yeah, which is almost the complete opposite to what it is now. And then finally, my conclusion, which actually talks a lot about the ethical issues and then kind of bringing together my whole project. So next, my research. My main source of information was from the internet. So I did obviously the vast majority, or I did all of my EPQ over the first lockdown. So this kind of did limit my resources slightly. I used a large range of websites. Many actually were articles, so published medical articles. This kind of, I guess, meant that my resources were reliable. And yeah, I found that there's plenty of information on the internet. I didn't feel the need to actually look for example, books or contact that many other people. Yeah, I really enjoyed the research aspect of the project. I found the topic really interesting. I literally love learning about the medical profession. So yeah, that aspect, yeah, I really enjoyed it. I guess the research skills I've acquired would be really useful in further education, and then hopefully actually a career in medicine, which is one which is constantly evolving and growing. I was also, I found it very enjoyable to be able to gather all these pieces of information from a wide variety of resources and then kind of bring them together into one project. Yeah, so I guess unfortunately I wasn't able to access a kind of wide variety. So I wasn't really able to go to any libraries or speak to that many people. So I guess ideally I would have liked the opportunity to not just look up things on the internet, but also get information from books and even speak to some medical professionals. I definitely think that their experience could have given me, I guess, a different viewpoint, but would have also given me some more valuable research skills. Okay, so my reflections. What have I learned? Obviously, I've learned about informed consent, laws, comparing adults to children, ethical issues. But I've also learned, I guess, to think more deeply into possible ethical issues in medicine. And skills as well. My research and time management skills have definitely improved. Also, something I think I would overlook at the beginning, it was my learning how to reference correctly. This is like, it's definitely vital for further education. And another one actually would be skim reading. Definitely improved as I kind of went along. It was a lot quicker and more efficient. Yeah, something that I've definitely improved upon. What have I found most interesting? So definitely the ethical dilemmas. For example, I guess parents having differing opinions to physicians and kind of what happens in those scenarios. I also found it, I guess, pleasing to find that children do have some authority, as well as I enjoyed looking into the decisions which physicians have to make, because at the end of the day, it's their say as to whether they deem a patient to have capacity to make a decision for themselves. So the strengths and weaknesses. A strength, I would say, would be my time management. I had kind of set myself a goal to have finished it by the 1st of September, which I was able to do. So finish this, I guess, alongside schoolwork and other kind of commitments. I was also happy with my subheadings. I think they give a good overview of the topic. Weaknesses probably could have, well, definitely could have been written better. So the flow, I guess, could have improved and maybe better clarify some points. So it can be a little less confusing. I guess it's hard because, yeah, I'm not coming from a point of view of someone who doesn't know anything about the topic. Also, I didn't fully reference my sources as I went along, so it kind of left me a lot to do at the end, something I definitely wouldn't do next time. And then if I were to rewrite my project, I possibly would change the order which my subtopics were in. For example, maybe move history further near the beginning, but I guess that would have been easy to do. But overall, I'm really happy with my project. I'm glad I chose it. Are there any questions?
Hi, Harriet. Thank you very much. That was a fantastic talk. I've got a question for you. I've been thinking about the COVID vaccine today. I wonder what, it seems to me that there's a danger potentially of some parents who are that way inclined not wanting their child to have the vaccine.
Yeah.
Can you just talk through some of the issues around that, please?
Yeah. So I suppose if, let's say, a child decided and didn't share the same beliefs as their parent, they could still go perhaps to a GP or go to I guess, wherever the vaccine's available. And if the person delivering the vaccine deems them to have capacity, they understand, I guess, the pros and cons of having the vaccine, perhaps future implications. If they understand all of this, then ideally they would then be able to have the vaccine and disregard whatever their parents have to say. They'd be able to make a decision for themselves and essentially wouldn't need consent from parents.
So what would be the age when that would be possible then?
Yeah, so if you're 16 or 17, it's almost as if you're an adult, so you are assumed to have capacity. So I would say definitely, unless there's kind of something screaming out saying no, they would then be able to get the vaccine. And then under 16, so this is the idea of Gillick competency. So the physician or whoever's giving the vaccine would kind of have to ask themselves a few questions, kind of, I guess, the age of the child, how much information they know, their mental kind of maturity. There's not really a set age. It would change from case to case basis, whether they then saw that child as having capacity. So I guess a child of 12 they might deem as not having capacity, even though a child of 7 might. It just depends, depending on the child themselves.
Mm-hmm. Great. Do you have another question?
Could I ask? I think I'm back on. Yeah. Harriet, sorry, I'm really not a techie. Do you think it should change then? I just had to Google whether you were saying Gillick or Gillick competencies. I've learnt a lot this afternoon. Do you think it should change then, this age or the system in general?
I personally agree with the current system. Obviously, I guess a few tweaks maybe could be made, but yeah, I definitely think that the ability of kind of children to make their own decisions is definitely there. And I guess I definitely agree, because it doesn't, age is just a number. Like, it's not, there has to be other factors taken into account, and I definitely think this current system does take that into account. I also think that the current system also does respect parents' views and physicians' views. It kind of takes them all into account, which I think is very important as well.
May I ask a question?
Yeah.
Harry? Yep. Okay. This is actually from Georgia, your sister, who's watching on FaceTime at the moment. Do you think it is important for medical students to learn about medical ethics? And if so, why?
Yeah, no, definitely. I think it's really important. I guess a really main reason would be that if you're faced with a situation, I suppose like an ethical dilemma, you don't want to be in that situation and never kind of thought of it before. So I guess having covered medical ethics previously, it would kind of, I guess, decrease the stress, your stress levels, and hopefully, I guess, make sure that you make the right decision at the end of the day. Yeah, so I guess just ultimately make physicians more comfortable with the idea. No need to, I guess, think on their feet as much, and yeah, ultimately improve decision making. I definitely think it's a huge part of medicine.
Thank you. I agree.
So Harriet, you're talking about kind of age just being age is just an age. It's not, just because you're a certain age doesn't mean you're competent. Is there a kind of set of questions or a set of sort of like check boxes that doctors have in order to determine whether someone's competent or not, or is it just a kind of general idea?
No, yeah, there is. So for, I guess, generally, if you're looking at whether they're an adult or a child, you kind of ask questions such as, is there an impairment or disturbance of the functioning of mind or brain? So that would kind of be the first thing that you ask. And if so, is that impairment sufficient that the person is unable to make a particular decision? And that would, you then deem them as unable to make a decision if perhaps they can't understand the information given, or they can't remember the information, whether they can use the information appropriately to make the decision, and also whether they can communicate their decision. So I guess that's kind of the process of a physician when they're deciding whether a patient has capacity or not.